Going back to Weston A. Price. Oh, I got some Weston A. Price pictures here. Nutrition and Physical Degeneration. If any of you guys have not read that book, I don't know what you're doing. You should be skipping calls to read that book. Because it's pretty much the Old Testament of the nutrition world here, showing very clearly that when people have good nutrition, their jaws are fully formed, they can fit all their teeth are not crumpled up, their teeth are all the proper shape, and they don't have cavities, they don't need root canals, they don't have dentists. And then as soon as they start eating processed foods, all of that goes away. And of course, we know that processed foods coincides with nutrient deficiencies, but he documented this 100 years ago. Everywhere he went, all over the world, didn't matter what culture they were, didn't matter what diet they had, as long as they stuck to their traditional diet, they had basically perfect teeth and perfect skeletons. And as soon as they stopped that, everything went downhill, including the teeth, especially the teeth. Holly's husband has his wisdom teeth. Well, congratulations. He's a rare one, and it's becoming even rarer. Okay, that's my whole spiel on arthritis today. No questions, comments. I didn't bring my water in. I've been looking around for it. I did not bring one. Voice gets hoarse after a while. Could you put the name of the book in the chat? Yes, it's Nutrition and Physical Degeneration by Weston Price. Very famous. I was very fortunate. I just stumbled upon that book in a thrift store close to the time that I got introduced to this. I had no idea that it was such an important book, and just very serendipitous to read that right at the beginning because it's so important. It is the starting point of modern nutrition, I think, and so many other books will reference that. Like it's a fundamental thing. And it's big. That book will keep you busy for a while. It's a great story, and it's just super, super important. I consider it mandatory reading. It's on my mandatory reading list. Okay, product I want to talk about today, Smart Sticks. I just got this sample with my products today. Don't know if you guys have got this sample as well. We have a few energy drink type of things in our catalog after, as well as we scroll down. So it's got a lot of symptoms here. Kidney disease, lupus. This might be a scary protocol to read for a lot of people. Saying, oh, I don't know what I could do for this person. High blood pressure, lupus, seizure, gout. These are all pretty serious. I'm just going to read it, and then we can talk about it afterwards. I'm going to ask you guys what you would do as well. She had ACL repair as a teenager. It's a ligament. Tied tubes, tubal ablation, no organs or glands removed. She's on 2 drugs for seizures. She's on 1 drug for gout. She's on another drug for the kidneys. Doesn't take any herbs or supplements. She's been avoiding beef, pork, chicken, fried, and products with gluten, but no allergies to any foods. Not pregnant. Drink sparkling water. A little tiny bit of alcohol, barely a glass of red wine. Not often at all due to the kidneys. Has labs. Going to show us. Favorite fruit is seafood. That's good. Fish, potatoes. Used to be beef, but I stopped eating it. Doesn't have an account in the pack.
Can we add the Ultimate Daily Classic from the first month?
You could. Okay, so this is all the same problem to me, right? In brief, it'd be multiple nutrient deficiencies and most likely processed foods. Although, kind of sounds like she eats some more of a real food diet here, which is good. And she's 49 years old, so a lot of, I don't mean to call them older, but like as soon as people get out of their 20s, basically, they tend to start eating better. So hopefully she's not living on processed food, but multiple nutrient deficiencies here, obviously. But this is all metabolic syndrome to me, right? She's overweight. And of course, we're going to start with digestion. And Alia knows what to say to get good grades from me. Of course, obviously, we're starting with digestion. Could you throw Ultimate Daily in right away? Yeah, you could. I have no problem with it. I like to start a bit smaller, but Why not? Because this is a medicinal product. This does not depend so much on absorption or anything like that. And it is very powerful. And she is in the US. It's available in the US. And you could also use cardio effects or even cardio sticks or even niacin plus. Any of these are cardiovascular stimulants, basically. Because as we know, as we say, that kidney disease is not really kidney disease to us. We don't believe there's practically ever anything wrong with the actual kidney. The kidney is just full of tiny little veins and they get clogged up quickly, especially when you have metabolic syndrome, which 100% she does, which is just a loose term that we use. Lots of people use. Just her whole metabolism is off here, and there's many things that can contribute to that. Of course, lack of probiotics and enzymes, which you'll get in this pack. It's one of them. She's not avoiding gluten. Well, she has been avoiding. I don't know how long that's been. You know, could have been a month, could have been a year. I this maybe I should next time. That's an idea. High blood pressure is the same sort of thing. Those veins everywhere, they're getting clogged up. There's deficiencies. Your muscles that push most of the veins around, they require calcium, magnesium, these same nutrients here, actually. They require all this. It even requires vitamin D. Actually, omega-3 as well. Omega-3 is well known to help clear plaque and stuff. This is why we generalize almost all these problems and say multiple nutrient deficiencies, because honestly, I could have taken the word arthritis out and put arteriosclerosis in here instead, and it'd be practically the same set of nutrients. Maybe I'd add and minus a couple more, but basically the same roadmap here for any problem, especially blood pressure. So if you didn't know, the heart does pump, but once it gets out of the main arteries, all the smaller veins have muscles on each side of them, and that's what pushes them the rest of the way through the system. So those all need calcium and magnesium to contract and relax, calcium to contract, magnesium to relax. So blood pressure can be relieved just with supplementation, but usually it comes along with the metabolic syndrome. Almost all of our hypertension customers are overweight, and it's obvious that they're overweight. They're usually significantly overweight, and so it's just an overall metabolic problem. Usually the blood pressure starts to come down when the weight comes down. They come down sort of around the same time, and usually this does take a while. Arthritis can happen quick. The inflammation can be gone quick. Pain can be gone quick. Blood pressure usually takes at least 3 months and then starts to come down more gradually. Whereas some other things like blood sugar, it can be very, very fast, where the A1C goes way up. Blood pressure is just not one of them, not usually. Lupus, to me, is also a digestion problem primarily, but clearly like the whole system's off here. When you've got all these different quite serious problems, I have to assume it's all part of the same syndrome. Seizures as well. You need so many nutrients here. Again, this is a pretty good chart just in general. You see omega-3s are key for the brain. I guess you would need selenium in here as well, but key for the brain. All the fatty nutrients here, D and K are both fatty. You need all this stuff for anti-seizure. If we could talk about almost any of the essential nutrients for seizures. Gout's a calcium deficiency primarily, because the key with this whole thing is calcium is required for alkalinity. You need to be alkaline. That's why when you are acidic, your body pulls calcium from the bones and the teeth to keep the blood from becoming too acidic. That's how your body buffers its own pH in the blood. And that's why consuming highly acidic things or things high in phosphorus for the same, well, for a different, same outcome is that the body pulls the calcium and the magnesium, mostly the calcium, to balance that. So it is the primary alkalizer. Gout is an acid problem. It causes pain because it causes crystals, little crystals of sugar, basically. Sugar is converted to lactic acid in the body. So I'm very surprised, actually, that she didn't write diabetes here, because this usually comes right along with diabetes. You got high blood sugar. The blood sugar converts to lactic acid. Now your body is too acid. And as a result, you get gout. And also, as a result, your body tries as hard as it can by pulling as much calcium as it can from your bones, teeth, and muscles. And so you get other things like cramps and weakness. You get people in wheelchair because of gout. Sometimes they're older and overweight and stuff. And You know, it's not just because of pain, it's because they become so weak and they're getting muscle cramps and pains and twitches and all this stuff because the body's desperately pulling calcium away from everything it can to try and buffer the acidity. So just saying, we know how to do this. Get off of processed foods, get on the 90 in general, because it's not just calcium, it's hydration, water, B vitamins, vitamin C, the other electrolytes like potassium and salt. We need all that stuff to be alkaline. And when we have all that put together with proper calcium, the body has no problem doing it. And now instead of taking calcium out of the bones, it's putting it back in and into the muscles too. And you know, you get things like high blood pressure go away and stuff. And these other problems here are not necessarily deficiencies, although there are many deficiencies associated with lupus, especially B vitamin deficiencies. And they will call this an autoimmune problem, but we know that body just has an overall immune problem. Obviously it does. And obviously there's many deficiencies involved in that. So I don't know what I recommended to her. I will find out because this is from last week. We'll scroll down a little bit, but I don't disagree with this. You guys have heard me say before, the most important thing is getting them started here. So almost anything that you start them on, I think you'd be fine with just getting them started. Hopefully they do fine on it. I don't see anything else here. This just looks like classic metabolic syndrome to me. Some people might get freaked out and think this is 5 different problems. Yeah, 5 different problems, but it's not to me. All the same thing. She's on a bunch of drugs here. What do we do about these drugs, guys?
We can't tell her to get off of them, but we could recommend her talking to her doctor to maybe for options to reducing the dosage just to see what they're recommending.
Yep. Monique knows. That is exactly what we can do. Products. Okay, well, we're allowed to talk about drugs. And, you know, I gotta assume by the time they reach out to us, they've seen or heard us say some stuff and they must agree with something that we say. And, you know, maybe they understand, they've already heard us say that drugs don't fix the root of the problem. So absolutely, I would not ever tell somebody, we cannot ever tell somebody to just stop taking drugs, especially kind of these serious ones. These should be weaned to the best of my knowledge. And Joseph, you don't need to tell them to wait a few months. Monique is correct. You should tell them to inform the doctor that they want to wean off, because something that is helpful here for you guys as well in trying to help them, they should understand, the customer should understand that when they fix digestion by going gluten-free, enzymes, probiotics, the whole thing we talk about all the time. When they fix digestion, they absorb more drugs. You absorb more caffeine, you absorb more alcohol, you absorb more nutrients. When you fix the digestion, you absorb more of everything. So if they're on drugs, especially a handful of drugs here for a handful of different problems, probably from more than one doctor, by the way, they should inform them because you should expect to absorb more of them. So the doses should be lowered anyways. And you know, the more drugs they're on, the closer they already are with their doctors. Like obviously this person is a good customer of their doctor. They go back to they have a relationship here. They should absolutely be monitoring you when you're attempting to wean them. We don't need to freak them out about this, but I've found it's a useful phrase. Telling them, hey, you're going to absorb more of these drugs. So you should be proactive in lowering the doses regardless, because you will actually absorb more of the active ingredient. And these are not two of the 2 worst drugs. So I'm not that concerned. It's not proton pump inhibitors or statin drugs. So they're not going to fundamentally get in the way. They should be weaned rightfully. There is withdrawal concerns.